Hello, and welcome to the Alert Youth Educational Workshop. Alert Youth is an awareness program made up of two components. The first component is the ID booklet, which is targeted to youth aged 9 to 18 years old. It is to be used as a reference detailing your physical and environmental information. The second component is the educational workshop, which seeks to cover topics that youth may be struggling with, such as substance use, gangs, teen pregnancy, depression and anxiety, runaways, bullying, internet, eating disorders, and relationships. The Alert Youth booklet is meant to provide your family, friends, and law enforcement with valuable information that could potentially be used for locating or identifying you if you ever go missing. This booklet is to be stored in a safe place with a trusted friend or family member. Child Find will not retain any of the information. It is up to you to keep this booklet updated on a regular basis, so use a pencil when filling it out and let a trustworthy person know where it is located. The topic we will be discussing is substance use. Teen years are when a lot of people start experimenting with substances. So what is substance use? It's the use of alcohol, cigarettes, and other drugs. This is a major concern for parents, guardians, and school officials. Drugs and alcohol are dangerous. The results from even trying them vary in severity. Loss of control, disruptive conduct, antisocial attitude. These are the most common results, but over time they can become much more severe. Addiction, jail, and death. The most common substances which youth choose to experiment with include the following: alcohol, marijuana, tobacco, vaping, prescriptions, over-the-counter medicines, and other drugs. Addiction is characterized by its frequency, so how often a substance is used, the tolerance, so its capacity to endure effects of a substance, dependence, whether or not the substance is relied on for physical, mental, or emotional well-being, and withdrawal, so symptoms that occur due to the discontinuation of a substance, often abruptly. When teens drink alcohol, it affects their brains in the short term, and repeated drinking can also have an impact on the brain down the road, especially as it grows and develops. An intoxicated person has a harder time making good decisions. They also have impaired motor coordination, are less aware that their behavior may be inappropriate or unsafe, have a greater risk of being injured from falls or vehicle crashes, may be more likely to engage in unsafe behavior, including drinking and driving, unsafe sexual behavior, and aggressive or violent behaviors. They are also less likely to recognize potential danger. Research suggests that drinking during the teen years could interfere with normal brain development and change the brain in ways that have negative effects on information processing and learning. This can increase the risk of developing alcohol use disorder later in life. Alcohol can affect your ability to think and react, lead to social issues for teenagers, and it can lead to an addiction. So then why do teens drink? Peer pressure, boredom, to feel grown up, to feel good, to relax, to take risks, and maybe even to rebel. When people drink alcohol, they may temporarily feel elated and happy, but they should not be fooled. As blood alcohol level rises, the effects on the body and the potential risks multiply. Based on data from 2006 to 2010, the CDC estimates that, on average, alcohol is a factor in the deaths of 4,358 people under the age of 21 each year in the US alone. So of these deaths, 1,580 deaths come from motor vehicle crashes, 1,269 from homicides, 245 from alcohol poisoning, falls, burns, and drowning, and 492 from suicides. Consuming a dangerously high amount of alcohol can also lead to overdose and death. When people drink too much, they may eventually pass out. Reflexes like gagging and breathing can be suppressed. So that means people who have had too much alcohol could vomit and choke or just stop breathing completely. Vulnerability to overdose increases if you are already on a sedative, hypnotic, or a pain medication. Marijuana uses the consumption of cannabis plants through different methods, such as inhalation, oral, or topical. THC is responsible for many of the drug's mind-altering effects. When marijuana is smoked or vaporized, THC quickly passes from the lungs into the bloodstream, which carries it to organs throughout the body. Its effects begin almost immediately and can last from 1 to 3 hours. This can affect your decision-making, concentration, and memory for days after use. Marijuana use can affect psychological processes, cognitive processes, physicality, and behavior. Symptoms of marijuana use include memory impairment, a lack of motivation, increased appetite, weight loss or weight gain, nervous or paranoid behavior, impaired judgment, and anxiety. Marijuana use can lead to a cannabis use disorder, which is often associated with early, prolonged, and increased use of marijuana. Like many other drugs, nicotine increases levels of dopamine, which is released naturally when you experience something pleasurable, like good food, your favorite activity, or spending time with people you care about. When a person uses tobacco products, the release of dopamine causes similar feel-good effects. This effect wears off quickly, causing people who smoke to get the urge to light up again for more of that good feeling, which can lead to addiction. Each cigarette contains about 10 milligrams of nicotine, so the average person gets about 1 to 2 milligrams of nicotine from each cigarette. Studies of widely used brands of smokeless tobacco showed that the amount of nicotine per gram of tobacco ranges from 4.4 milligrams to 25 milligrams. Holding an average-sized dip in your mouth for 30 minutes gives you as much nicotine as smoking 3 cigarettes. So a 2-can-a-week snuff dipper gets as much nicotine as a person who smokes 1.5 packs a day. Whether a person smokes tobacco products or uses smokeless tobacco, the amount of nicotine absorbed in the body is enough to make you addicted. Tobacco use is the leading preventable cause of death in the US and Canada. So people who use tobacco are at an increased risk of death from cancer, particularly lung cancer, heart disease, lung diseases, and accidental injury from fires started by dropped cigarettes. Vaping can also be very unhealthy. Research shows that many teens and young adults don't realize that the flavors they use actually can contain nicotine, which is the addictive compound found in tobacco. Many vapes also contain propylene glycol, glycerin, chemical flavorings, and other compounds with unknown health effects. As a result, people who vape, even just flavoring, may inhale and ingest potentially harmful chemicals. Recent studies showed that students who had already used any type of e-cigarette by the time they started 9th grade were more likely than others to start smoking cigarettes and other smokable tobacco products within the next year. In 2020, thousands of people got sick and dozens died from an illness called E-Valley, which stands for e-cigarette or vaping use associated lung injury. Vitamin E acetate, an additive in some THC-containing vaping products, is strongly linked to E-Valley. Prescription drugs are often strong medications, which is why they require prescription from a doctor or dentist. There are 3 kinds of prescription drugs that are commonly misused: opioids, depressants, and stimulants. Every medication has some risk for harmful effects, some including death. Doctors and dentists consider the potential benefits and risks to each patient before prescribing medications, and they take into account a lot of different factors. When prescription drugs are misused, they can be just as dangerous as drugs that are made illegally and just as addictive. More than half of the drug overdose deaths in the US and Canada each year are caused by prescription drug misuse. Over-the-counter drug use refers to someone using drugs that they can get without a prescription. Though they're less common to misuse, they can cause addiction and some serious health problems. These include memory loss, kidney failure, liver disease, heart problems, and death. Most commonly abused is cough medications, diet pills, and painkillers such as acetaminophen or ibuprofen, all of which taken in large doses can cause your body to shut down. There are various other drugs which are usually referred to as hard drugs. These include drugs such as cocaine, heroin, MDMA, meth, bath salts, steroids, and more. These drugs are highly addictive and they have a higher chance of killing you. Injecting potent drugs can be particularly dangerous because this route delivers the compounds more directly to the brain than ingesting or snorting drugs. Injection also carries the risks of injury and infection. More than 3 out of 5 drug overdose deaths involved some type of opioid, either prescription pain relievers, heroin, or human-made opioids like fentanyl. Among young people aged 15 to 24, over 5,400 deaths from drug overdose occurred in 2017. Fentanyl is often mixed with other drugs such as heroin, cocaine, methamphetamine, and MDMA, and can be ingested unknowingly at unknown quantities, which can lead to overdose. Drugs are chemicals. When someone puts these chemicals into their body, either by smoking, injecting, inhaling, or eating them, they tap into the brain's communication system and tamper with the way nerve cells normally send, receive, and process information. Some drugs, like marijuana and heroin, have chemical structures that mimic a neurotransmitter that naturally occur in our bodies. In fact, these drugs can fool our receptors, lock onto them, and activate the nerve cells. However, they don't work the same way as a natural neurotransmitter, and the neurons wind up sending abnormal messages through the brain, which can cause problems for both our brains and our bodies. Other drugs, such as cocaine and methamphetamine, cause nerve cells to release too much dopamine, or they can prevent the normal recycling of dopamine altogether. This leads to exaggerated messages in the brain, which can cause problems with your communication channels. It's like the difference between someone whispering in your ear versus someone shouting in a microphone. So why do teens use substances? There's peer pressure, they like the way it makes them feel, it solves problems, it's a coping mechanism, and they just want to experiment with something new. Abusing any form of substance can lead to a road of self-destruction and other problems, such as conflict with parents, peers, and law enforcement, depression, suicide, and troubles at school. Problems associated with substance use include issues at school, poor work habits, problems at home, loss of friends, lasting legal problems, injury, car accidents, violence, and drowning. So what are the signs of substance use? There's red or glassy eyes, a loss of interest in school and their regular activities, and a loss of interest in friends, or their new friends have little interest in their families or school activities. So what should you do if you think that your friend or family member is using alcohol, tobacco, or drugs? You want to talk openly, encourage them to open up, be supportive and caring, and refrain from using judgmental words. Substance use risk dramatically decreases if you keep yourself busy and make choices to stay away from drugs and alcohol. Alternative choices for you to choose include recreational activities, sports, clubs, and group functions that are drug and alcohol free. If substance use has become a problem for you, there are treatment options. You can talk to a trusted adult, speak to your doctor, seek professional advice from a counselor or therapist, and there are many rehabilitation programs that can help. If you don't feel comfortable talking to someone in person, remember, you can always call or text Kids Help Phone. So who is a trusted adult? A trusted adult is someone who you have a good relationship with, you know them well, helps you and makes you feel safe both online and offline, never asks you to keep secrets for them, listens to you when you have a question or a concern, and they respect your body and your personal space. Some of the information is provided by the National Institute on Drug Abuse, National Institutes of Health, and the U.S. Department of Health and Human Services. Thank you for joining us today.